parenting tips. Between 9 and 18 months, your baby will learn how to feed herself. Here's how to encourage her. At 9 months, you'll notice your baby holding the bottle longer or move on to a training cup. She will enjoy smearing foods and be happy trying to use utensils. Let your baby experiment with utensils, but make sure they are plastic coated and baby safe, so that she doesn't hurt herself. To encourage your baby to feed himself, give him mashed foods like peas or beans, or lumpy foods like oatmeal, which are easy for him to eat. At around 1 year of age, your baby may start picking food off your plate and exploring self-feeding. At this stage, you can offer your baby finger foods and training cups. He might spill some, but that's all part of learning. If your baby is walking already, he might not sit still at dinner time. Yet try to include your baby at all your meals and encourage his exploration. What can you expect during the first few visits to the pediatrician? The first visit to the pediatrician usually occurs within the first week of your baby's life. The pediatrician will check your baby from head to toe and watch for the degree of weight loss since birth. Up to 10% of weight loss is considered normal. The following visits to the pediatrician usually occur at 1 month, 2 months, and 4 months of age. These visits correspond to immunization visits. During these visits, your pediatrician will check your baby's growth by measuring his head, body length, and weight, his eyes for visual tracking and alignment, and ears for infection or fluid. The doctor will also listen to your baby's heart and check his lungs and abdomen for abnormalities. It is a good idea to bring a list of questions and concerns when you visit your pediatrician to make sure you get all the information you need. Here's a good rule of thumb. During the first 2 months of life, take your baby to a doctor every time he has a fever over 100 degrees Fahrenheit. Breastfeeding your baby has many great benefits. Breast milk, naturally designed for your baby, is easily digested and contains antibodies, which builds baby's immune system. Breastfeeding, just like bottle feeding, encourages bonding and attachment between mommy and baby. However, breastfeeding can sometimes be a real challenge. Some moms may have inverted nipples or cracked nipples. Others might find it doesn't come so naturally to them. Often, moms need time to figure out just how to do it right. And they need lots of support in the process. Some moms need their own moms to help them. Others prefer professional help. Most hospitals have a lactation consultant on board. It is a good idea to get help right in the hospital by learning some tips on different breastfeeding positions and ways of relaxing. In fact, learning how to relax is one of the keys to successful breastfeeding. Dads can help too. They can feed baby breast milk in a bottle. They can bring baby to mom in the middle of the night for a feeding, support mom by giving her attention, and telling her she is doing a great job. Guess how many diapers a baby will go through in 1 year? On average, 3,000. Diapering a baby for the first time can feel a little complicated. So here are some tips. First, make sure you put your baby on a safe area, a changing table or the floor. Always have one hand on your baby in case she tries to roll. Make sure you have everything you need next to you and out of the baby's reach. It's a good idea to cover your little boy's genital area so he doesn't spray you. Always wipe your baby from front to back. Make sure the diaper is not too tight around your baby's abdomen or thighs. If the diaper is leaking, try moving up one size. Diaper size should be based on your baby's length and weight rather than age. Many babies get diaper rash from time to time. Changing baby often might help diminish these rashes. You can also air out your child. Let him lie around. Let him lie without a diaper for a little while. If your baby has severe diaper rash with dots or blistering, consult your pediatrician. Your baby will start recognizing his caregiver at around 4 or 5 months. She will smile to those she recognizes, but he might refuse to be held by people he doesn't know, and he might even cry. This behavior is called stranger anxiety, and it is a very natural step in your baby's cognitive development. Stranger anxiety is the reason it is better to introduce a new caregiver in the early months of life. This way, your baby will already know that person and feel safe with him. But if you need to bring in a new person into your baby's life after he is 5 months old, there are steps you can take to make it an easier transition for him. Bring the new caregiver into your home to meet your baby and spend time with the two of them. Give your baby a chance to approach the new caregiver at her own pace, and have that person bring a toy or book to play with your baby. Remember that each child is different, so different babies have varying degrees of stranger anxiety. The moment you need to put your baby into daycare always comes too soon. But what should you be looking for when searching for a good nursery for your baby or toddler? Here are some of the questions you might want to ask. Is the place health and safety regulated? Is the person running the place certified? What kind of child development knowledge do the caregivers have? Are they CPR certified? Do they smoke? It is important to interview the director of the nursery and talk to other parents who send their children there. Also, spend time in the prospective daycare. Look around it. Is the place clean? What is the ratio of staff to babies? What developmental activities does the nursery have for children? Ask yourself if the place can promote your child's physical, emotional, and cognitive development. If the daycare center does not have an open door policy and doesn't allow you to come and observe, be cautious. Lastly, it is a good idea to have a copy of your baby's medical records information at the nursery in case of an emergency. What is the right age to introduce solid foods to your baby? Pediatricians' recommendations change from time to time. At the moment, baby experts recommend introducing solid foods to a baby who is 6 months old, can sit up, and has doubled his birth weight. Nutritionists recommend starting your baby with root vegetable purees because they are naturally sweet. The best fruits for your baby to eat first are apples and pears because they are easy to digest. It is a good idea to introduce one vegetable or fruit at a time, so it is easier to discover if your baby has any food allergies. Try each fruit or vegetable for 3 days in a row before switching to another. Cow's milk should be introduced later since it can be very allergenic. from a spoon is very different from sucking, so your baby might need time to adjust. It is very likely that at first your baby will spit up everything. Be patient. Different children have different tastes, so just keep trying with different foods. Do you listen to your baby's sweet babbling and wonder when she will say mama or dada? Well, each baby has his own pace, and individual variations in language development are very normal. Between 6 to 9 months, many babies begin to communicate more. They usually start by making vowel sounds first, like ah, and later add consonants, such as ba. Your baby will start imitating speech patterns even though he is not saying any real words. To encourage this babbling, read books with him. Label items in his world by pointing and naming them. Mirror the sounds that he makes and talk to him in full sentences. Babies learn a lot when you talk to them. Soon your baby will imitate you and repeat words over and over again. At around 9 months, he might make up his own first word. Don't worry if you don't understand the word. It is not really a word yet. Between 9 to 12 months, your baby's babbling will sound more and more like speech. And that is the time you might hear his first real word. Scientists, as well as many parents, agree that between the ages of 0 and 3, it's vitally important to expose your child to a wide range of positive and constructive experiences. However, babies love and need repetition. That is why television programs that are designed for babies and toddlers have a certain amount of repetition in them. Repetition is a very good learning tool for babies.
Ball, good.
It gives them a chance to predict what is coming next. And that in turn gives them a great sense of confidence. Repetition makes your baby feel her life is structured and predictable. Repetition reinforces learning. It helps your baby recall and remember the main content of the program. So use repetition to maximize your child's learning experience. With that said, too much repetition and even a baby will become bored. So avoid over-repetition of programs. You are the best judge of when she has had enough and needs something new. Your baby will blossom with a balance between repetition and new experiences. How much educational viewing does your child need? You be the judge. Experts agree that appropriate TV programs can enhance your child's learning. But parents need to carefully manage their child's viewing time. It is recommended that a child under 3 should not watch more than 2 hours per day. Choose the right programs for your child so that he can make the most out of his limited viewing time. Each program on BabyFirst is color-coded to indicate the development area it targets. Match the programs to your child's state of development and use your judgment as to how much educational viewing is proper for him. When your child watches TV, observe her closely to see if she has lost interest in the screen and is showing signs of restlessness or boredom. Don't be afraid to turn the TV off. You can always turn it back on tomorrow. Have TV viewing as one kind of stimulation your child receives during the day. After all, even children can get too much of a good thing. Sometimes a pacifier can be mommy's little helper. But is it good for your baby? When deciding if to introduce a pacifier to your baby, consider the advantages and disadvantages of using one. Some of the advantages are: a pacifier helps babies self-soothe. Some studies show a decrease of SIDS, sudden infant death syndrome, when a pacifier is used. And it is easier to get rid of a pacifier than to get your baby off thumb sucking. Some of the disadvantages of using a pacifier are a possible increase in ear infections, the need to put the pacifier back into baby's mouth at night, and prolonged use may delay speech development. Thus, when your baby is 6 months, it's a good idea to try to leave the pacifier in the crib so he is less dependent on it. If the use of the pacifier continues till 3 or 4 years of age, there are some steps you can use to wean your toddler off his pacifier. Prepare them by talking about it. Use positive reinforcement. Praise them when they don't use it. Make a date on which to throw the pacifier away, like a birthday. Now that your baby is 2, you must be hearing the word no quite often. Your toddler's growing sense of self is what spurs that assertive no, and experts say it is a good sign of appropriate development. It can be wonderful to watch this budding independence, but it can also be draining. Here are some tips on how to turn the terrible 2s into the terrific 2s. Look for ways to encourage your toddler's independence while maintaining an ordered and structured environment. Let your toddler make his own decisions, but offer limited options. Give her some control. Ask her, do you want milk or juice for breakfast? Give your toddler some responsibility. It can be his job to put napkins on the table. Avoid unnecessary battles. Give in when it's really not important. This will give him a sense of ownership and pride. Sometimes nothing will help, and your 2-year-old will throw a tantrum. When that happens, keep your cool, and remember, at this age, most toddlers can understand more than they can express themselves, and that, at times, leads to frustration and tantrums. Does your baby have long crying spells every afternoon? If he is between 1 and 3 months of age, he might be suffering from colic. There is no known cause for colic, but some pediatricians think it has to do with the immaturity of a baby's intestinal system. Whatever the cause, colic is not dangerous for your baby. In fact, 25% of babies suffer from it. Yet, if your baby is very colicky, it is a good idea to let your pediatrician examine him to make sure nothing else is hiding under these symptoms. Usually, physicians find nothing and treatment is left to you, the parent. Most times, holding your baby and rocking him gently helps. Try different positions. Some babies like to be held on their tummy. Others like to be held at a 45-degree angle. Sometimes a car ride helps. Try to relax yourself so you don't pass the tension to your baby when holding her. You can also try organic gripe water. Some parents find it to be very effective. Remember, your baby will grow out of these crying spells, probably around 3 months of age. Stand. At around 10 months, babies can stand for a while, as long as they are holding on to something. Then, by the time they are 11 months of age, babies can move around the room supported by furniture. Finally, by around 1 year of age, your baby is ready to walk. Here's how you can encourage your baby's first steps. Confidence is the key to get her started. So let her rest in a standing position while holding on to something to build her confidence. You can also stand several steps away from your baby and call her to come to you. Compliment her on a job well done. To strengthen your baby's motor skills, build a kind of obstacle course for her. Remember, mobility can put your baby at risk, so watch her carefully, but let her enjoy her new freedom.
Subscribe now.